my name is Pinn and today I'll be talking about SYMPTOM-UGI study, which is a mixed method study exploring factors impacting symptom appraisal and help seeking in esophagogastric and pancreatic cancer patients and its impact on time to diagnoses. Pancreatic cancer has the highest mortality rate among all cancer types. Esophageal cancer has a 5-year survival rate of 16%, and gastric cancer has a 5-year survival rate of 27%. These numbers reflect presentation of these cancers at a relatively late stage, and time to presentation and time to diagnosis for these cancers are longer than other common cancers. We aim to examine patient tumour and symptom factors associated with longer time to presentation and time to diagnoses in pancreatic and esophagogastric cancers by looking at patient interval and diagnostic intervals. A secondary aim was to assess the feasibility of recruiting patients through Monash University's Upper Gastrointestinal Cancer Registry. We had 90 eligible patients who were invited into the study. 27 responded to our invitation and completed the SYMPTOM-UGI survey. All their GPs were invited to complete a GP questionnaire, and 22 GPs returned the questionnaire. 13 patients completed the SYMPTOM-UGI interview, and data was also collected from the UGI-CR. From our data, we found that the most common symptoms in pancreatic cancer was pain in the upper part of the stomach and jaundice, and the most common symptoms in esophagogastric cancers were regurgitation and unexplained weight loss. At the bottom here, we can see that pancreatic cancer has a shorter patient and diagnostic interval when compared with esophagogastric cancer. This may be due to the fact that pancreatic cancers often present with jaundice, which leads to urgent and immediate referrals, which often leads to shorter intervals. From our interviews, we found that patients had a lack of symptom awareness, as well as normalizing, dismissing, and misattributing their symptoms. We also had patients who self-managed their symptoms, and we found that patients who did not self-manage their symptoms had a shorter patient interval and diagnostic interval when compared to patients who did self-manage their symptoms. We also looked at help seeking. On the left here, this man says, probably if Anna hadn't been sick, I might have done something and gone to see the doctors a bit earlier. So in his case, personal events delayed his help seeking. On the right here, this woman said, I had this pain in the middle of the night, all around my stomach, and I called the ambulance and they took me to the hospital. So in her case, an acute onset of symptoms led to help seeking. Our findings adds to the literature and highlights factors influencing symptom appraisal and help seeking. And despite our small sample size, we successfully recruited newly diagnosed pancreatic and esophagogastric cancer patients through the UGI-CR. In the future studies could focus on targeted symptom awareness campaigns, as well as focus on esophageal, gastric, and pancreatic cancers separately in larger cohorts. Thank you.